Good evening. Thanks. This is a...
Okay, there. Thanks. That was nice, Ed. Thank you very much. My name is Dr. Kevin Weiland. A brief introduction. I am an internal medicine specialist here in Rapid City. I'm in primary care. I'm a graduate of the Sanford School of Medicine. Essentially, I call myself a lifelong resident of South Dakota. My wife and I, Dr. Lori Weiland, who we met over my dead body in gross anatomy in 88 of 88 at 8 o'clock, I like saying that. She's a neurologist at the VA Medical Center. I chose Ed Picardi just briefly. I've known Ed for 13 years since I started practicing here. He's a very ethical physician, a good physician, and we're friends, and we are opposite on this. And just to refresh your memory on the resolve of this issue is that, will this union repeal healthcare reform? And this is the question that we ask. Not about little bits and pieces, is whether we repeal this healthcare reform bill. I just want to briefly take you back a little bit here. It's been well over a year since President Obama signed the Patient Protection and Affordability Care Act, called ObamaCare. And it has been just as long since I made an almost challenge to our lone representative after her vote in opposition of this historic bill. In just 10 days, 3,834 frustrated fellow South Dakotans, an astonishing number, signed my petition to put my name on the ballot. There were many reasons why I made the decision to want to run. However, in the end, there were many more reasons why I did not. One of the most compelling was that of my young family. But I got some assurance from Congressman Herseth Sandlin that she would not vote to repeal health care, and that made my decision easier. Now, the political pundits have made a lot about this, and no more can be done than what came out from my naive heart, that no one forced me from the race. It was simply not the right time for me. Now we're looking at 1 year later, our Attorney General, Marty Jackley, of the state of South Dakota and 24 other states are attempting to block the implementation of this new health care reform law, claiming that it is unconstitutional to mandate health care for everyone. Now, the law is the law, and if we want to repeal the law, this will have to go to the Supreme Court, and this is where it will go, whether it is constitutional or not constitutional to mandate health care for everyone. And more recently, a lot of attention came to Florida in a decision in the case striking down the Affordable Care Act. The ruling was essentially out of the mainstream of the current judicial opinions. We have 12 other judges that have already dismissed challenges of the reform law, and 2 judges have actually upheld its constitutionality. And as of Friday, a motion was filed by the government to the 11th Circuit Court of Appeals arguing that Congress has the power to enact the overall minimums coverage requirement because it is, in quotes, rational means of regulating the way participants in the healthcare market pay for their services. The motion also warrants other pieces of overhaul, including a law that blocks insurers from denying coverage to people because of pre-existing conditions. Would be unworkable without a minimum coverage provision in the law. Now, having failed in the legislative arena earlier this year to block reforms, opponents have turned to the courts to try to overturn the work of the democratically elected branches of government. This is nothing new. We have seen this with other monumental legislation, such as Social Security Act, the Civil Rights Act, and the Voting Rights Act. Constitutional challenges were brought to all 3 of these monumental pieces of legislation. All of those challenges failed. So too will the challenges to this health care reform. The Affordable Care Act falls well within Congress's power to regulate under the Commerce Clause, the Necessary and Proper Clause, and the General Welfare Clause. In order to make health care affordable and available for all, the law regulates how to pay for medical services. This is not a social engineered program. The Commerce Clause of the United States, Article 1, Section 8, Clause 3, states that the United States Congress shall have the power to regulate commerce with the foreign nations and among the states and with the Indian tribes. The Commerce Clause, and the opponents say that it only regulates commerce. Declining to obtain health insurance is not commerce, but refusing to engage in commerce and therefore cannot be regulated is the argument. The argument has been rejected in the past in 2006 by Gonzalez and Rigg. The court held that the belief that Congress can regulate interstate activity that is not itself commercial. The belief was also supported by Justice Kennedy, but subsequently also Justice Scalia. Is health insurance commerce? Insurance is commerce. We've known that since 1944. The Supreme Court upheld that. Healthcare insurance is commerce, as it holds up to 18% of our gross national product. Does Congress have the right to regulate healthcare? Of course it does. What is this power? It is the power to regulate or describe the rule by which commerce is to be governed. And the individual mandate is a rule or a system of rules by which commerce is to be governed. We talk about activity and inactivity in this piece of legislation. Those challenging the law claim that the individual responsibility mandate provision exceeds Congress's power to regulate interstate commerce because it penalizes inactivity. The claim is wrong. Individuals who choose to go without health insurance are actively making an economic decision. It's a novel argument, but I want to make 3 points on that argument. Activity and inactivity distinctions has no basis in the text of the Constitution. Courts recognized Wicker decisions in Carter versus Carter Coal Company in 1936 that Congress can regulate not only activity, but also conditions. Lacking health care is a condition. Businesses do not offer insurance to employers. That's a condition. Insurance companies decline to extend to it due to pre-existing conditions. That's a condition. And individuals fail to select it or pay for it, some out of choice and some because they cannot. These are actions with real-world and adverse consequences. The constitutional fate of a great nation cannot be decided by these semantics and word games that label real-world actions with inactivity. Enforcing individuals to buy products. This is what they're going to be talking about at the Supreme Court level. They've already talked about it at the judicial level. In Wickard versus Filburn in 1942, these questions were raised and they were eventually rejected. The plaintiff basically argued that as a result of the Agricultural Adjustment Act, individuals forced to buy a product, then food, on the open market. Justice Jackson wrote that Congress was forcing farmers into the market to buy what they could provide for themselves. This was essentially wheat. This is really identical to what we're discussing today, that individuals forced to buy a product, in this case health insurance, when they would rather self-insure or pay for a product of health care themselves. Justice Jackson at this time rejected the claim, noting that these questions are wisely left under our system for the resolution by the Congress. Basically, the market effect may not be substantial from one action like Mr. Filburn, who chose to use his own wheat alone, but through the cumulative actions of thousands of other farmers in this case, it would be obviously very substantial. This is a liken to what we're talking about today. Then they talk about ongoing with the personal responsibility mandate. The Constitution does not create or protect the freedom to freeload. There are 35 to 50 million uninsured, and these 40 million people have the right to go to the emergency room. And by law, the ER is not just ethically, but legally responsible for the care of those patients. This results in $40 billion per year in healthcare costs that the rest of us have to pay. Opponents to this bill claim that this is cost shifting. This cost shifting is constitutionally protected. We have no constitutional right to force people to pay for your health care when you decline to take that responsibility to care for yourself. Here's how the individual responsibility provision works. If the Affordable Care Act requires people who can afford it to carry a minimum health care coverage beginning in 2014. For those 83% of the Americans who have coverage today, this means that they are already taking that responsibility for health care, and they will need to do very little. Many of the 17% Americans living without health insurance either can't afford it or have been denied coverage because of pre-existing conditions. The Affordable Care Act provides tax credits to people who need help paying for insurance and hardship waivers to individuals or families who can't afford it at all. And the Act expands Medicaid coverage for many lower income families. Those who can afford insurance but refuse to buy it do face a penalty. because most people would voluntarily purchase coverage as it becomes more affordable, and the policy exempts those whom purchases would cause a financial hardship. The CBO, or the Congressional Budget Office, estimates that only 1% of all Americans would pay a penalty for not having health care insurance in 2016. The individual responsibility concept is seen in other areas of commerce. You can't get into your car, get into an accident, and then buy car insurance, for instance. To lower the cost of health care for everyone, we have to stop making those who act responsibly pick up this health care tab for those who don't. And that means we need everyone to be a part of this health care insurance. The individual responsibility provision is the key to the ban on discriminating against individuals with pre-existing conditions. Without that provision, there is nothing stopping someone from wanting or waiting until they're sick or injured to apply for coverage, since insurance companies can't say no. That would lead to double-digit premium increases, up to 20% by estimate, for everyone with insurance, and this would significantly cause an increase in costs in healthcare spending throughout our country. And finally, now that I briefly defended the constitutionality of the Affordable Care Act, I would like to focus a bit more on the benefits of this landmark healthcare reform. First, patients are no longer threatened with life cap coverages. Families no longer have to make hard choices for delaying care or facing bankruptcy. One of my patients early on in my practice came in with back pain without insurance. He just wanted treatment. I treated him conservatively for a while. I sent him to physical therapy. He came back about a year later with worsening back pain. He ended up having multiple myeloma. An MRI did prove it, and you know, the outcome on him was quite awful, quite devastating. I don't think the MRI would have changed the outcome, but certainly could relieve his suffering. Children with pre-existing conditions are no longer being denied coverage. Insurance companies can no longer deny coverage to children under the age of 19 because of a pre-existing condition or disability. And again, being an adult physician, one of my type 1 diabetic patients came in as an adult with evidence of diabetic neuropathy, diabetic retinopathy, and diabetic nephropathy, kidney disease, nerve disease, and eye disease, because of his diabetes was not being monitored by a physician because he had no insurance. Under this new law, this would change that. Young adults are getting covered on their parents' insurance. Again, my 25-year-old nephew went into the ER with supraventricular tachycardia. Had it not been for the Affordable Care Act, he would have had to pay out of pocket roughly $60,000 for further ablation of his cardiac arrhythmia. This would have bankrupted him. He is now going back to college. He's not in bankruptcy, and he's going on to be a productive citizen. Medicare fraud prevention is getting ratcheted up. $350 million was invested in 2010. We've already recovered $4 billion just in 2010. People in communities are focusing efforts on preventative disease. About $1 billion in 2010 and another $500 million in 2011 are going to programs for tobacco cessation, obesity prevention, care coordination, behavioral health, and a number of other things. Seniors, 4 million of them, are getting help with prescription medications. When Betty couldn't afford a medication for treating of her heart failure, she chose food. She goes to the emergency room. She spends 3 days there and $30,000 for a $20 a month prescription drug. That's ridiculous. This bill helps Betty. Hospitals are gearing up to improve quality and safety. They are gearing up throughout the country to step up efforts to prevent hospital-acquired infections because of this bill. Money is being landed into their pocket to prevent further infections. Small businesses are gearing up, are getting help covering their employees as well. Up to 4 million small businesses with 16 million people who will be eligible for a 35% tax credit. Now, just of note, small businesses less than 50 will not be required to buy health insurance. Now, as we continue this discussion, keep in mind that this landmark bill affects us all, and I want to remind each of you who are going to participate in this debate that because of this bill, you will be continued to be on your parents' insurance without a threat of being denied coverage. But don't vote for or against this repeal because it directly affects you. Rather, vote with the idea that this bill affects our parents who may have a pre-existing condition, that this bill gives them the luxury to change their job. Also think about your grandparents who have to take their medications and because of this bill don't have to choose between food and medicine. And remember that you too will be parents someday, and you may have a child with a genetic disease or an illness, And because of this bill, your child will have access to medical care without being discriminated against. This is a landmark protection that will strengthen the healthcare system. The court challenges to the law are legal merit, but if they were to succeed, uncompensated care costs could rise rapidly. Premiums for families would rise, and many of the benefits of healthcare reform may not reach the American people. That's it.